In Toledo, Justin Feldkamp, 13 ABC, Action News.
I see.
Up 1 over 2.
Mr. Carswell, nice going. Well, since the COVID-19 pandemic hit, there's been so much talk about how the virus affects people with pre-existing or underlying medical conditions. Tonight, we take a look at those who suffer from sickle cell disease. As 13 ABC's Alexis Means reports, September is Sickle Cell Awareness Month.
17-year-old Nia Thomas was born with sickle cell. The disease makes her more vulnerable to COVID-19. The high school senior is working to bring awareness about the chronic, painful disease.
Just do what you can to not be interacting with people that may have other high-risk situations, especially like now dealing with the coronavirus.
Sickle cell is a genetic blood disorder primarily seen in blacks and Hispanics. It causes pain, organ failure, and other ailments. Many patients have what doctors call pain crises from the disorder.
It causes all the obstruction, all the blockage, and then that results in all the pain and chronic organ damage that you see over the lifetime of the patient.
Dr. Crawford Strunk is the director of the Comprehensive Sickle Cell Center at ProMedica Toledo Hospital. The center was built to help keep track of patients as they transition to adulthood. That's because the doctor says some hematologists don't necessarily have the experience to manage the complexity of the disease.
It gives them an anchor and someone to rely on and know that they're going to be dealing with the same person for the next several years of their transition into adulthood.
He says there's no national registry or clinical research centers for sickle cell patients.
There is a cure, but it's not for everybody. And in fact, most patients, in fact, probably 90+% of patients don't have an adequate donor. They need either a brother or a sister who's a fully matched.
Dr. Strunk says patient treatment is based on pain management, blood transfusions, and other medicines. Thomas says her life depends on those treatments. That's why she's speaking out and hopes you'll hear her message.
I just want people to know that it's real and that just as they treat other issues or when people come in with other illnesses, we should be able to feel like we are comfortable and getting help from the first responders or doctors, and they will give us the right treatment that we deserve.
In Toledo, Alexis Means, 13 ABC, Action News.
13 minutes after 11, still to come on Action News tonight. Are you ready for some Big Ten football? Because it's coming back.